Good morning, everyone. You are very welcome to the Young People and Alcohol webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Without further ado, we will now share with you the opening address by Dr. Philip Crowley, HSE National Director of Strategy and Research. Following this video, we will hand you over to your host for the day, Dr. Sheehan, National Lead, HSE Alcohol and Mental Health and Wellbeing Programmes. Thank you.
Good morning, everybody. My name is Philip Crowley. I'm the National Director of Strategy and Research in the HSE, and I support the work of the Health and Wellbeing Division in the HSE, who are leading today's very important seminar. Topic being young people and alcohol. What do we know about it, and what should we be doing about it? A really important topic. It's part of the HSE Health and Wellbeing's alcohol program's work, and it's also a part of the EU Alcohol Awareness Week. So an important week, I think, where I think in Ireland we know alcohol is a very significant harm in our society, plays a very significant role in our society. It's hard to go to any event in Ireland where alcohol isn't a part of the event. It's advertising for alcohol is ubiquitous. And this clearly has an impact on young people in Ireland and on the kind of alcohol levels we see in our society that are hazardous at a population level, and certainly well above many of our similar countries. So I think we have an issue with alcohol in Ireland, and I think today's seminar is a really crucial move to try and see if we can explore what we know about it, what we're going to do about it for young people in supporting them in having a healthy relationship with alcohol throughout their lives. Obviously, the harm that can occur to young people can occur before birth, and we've done a paper recently on fetal alcohol damage to the damage that can cause, and it's very significant in Ireland, a very alarming figure. So the harm starts before birth, and I think it's something that we need to really have a comprehensive program of action across our society to deal with the potential harms to our young people. My clinical practice is with the homeless services in Dublin, and obviously I see a lot of people who have become homeless as a result of alcohol use. So I see, if you like, where all of this can end up. And if whenever needed a reminder of the importance of supporting people to have a healthy relationship with alcohol and manage alcohol carefully and well, then I think my clinical practice provides me with that reminder of how important this subject is today. So thank you all very much for participating. We have a great panel of speakers today. I think it's going to be an excellent event. And I'd really like to thank Sheehan for her work in this area and her team. So thank you all very much, and I wish you all the very best for the day.
Thank you very much, Dr. Philip Crowley, and good morning, everybody. You're all really welcome to today's webinar, which is on young people and alcohol. What do we know about it, and what can we do about it? My name is Sheehan. I'm the National Lead for the HSE Alcohol and Mental Health and Wellbeing Programmes. I'd like to thank Dr. Crowley for his leadership and ongoing support for our work in health and wellbeing, and welcome you all very warmly to today's webinar. And today we're marking European Awareness Week on alcohol-related harm. And the theme of this year is alcohol and the right to know. And we do know that alcohol is an incredibly harmful substance. We'd like to share with you and discuss some of the evidence base on alcohol and young people. We know that alcohol is a toxic, carcinogenic and psychoactive substance. It causes over 200 disease and injuries in Ireland. And even small amounts of alcohol we now know can cause lots of diseases, including breast cancer. Today's webinar, we're putting the spotlight on the evidence around young people and alcohol, but we do know that as a population, we need to reduce our alcohol use in order to reduce the harms that alcohol causes to people's physical and mental health and to safety and well-being. We have a great lineup of speakers today for our webinar. I'm delighted to be joined by Dr. Eoin McNamara, who's a research analyst for the Growing Up in Ireland study at the ESRI, by Doyle, who's the alcohol research officer at the Health Research Board, and Dr. Alexander Tran, who's a postdoctoral researcher at the Centre for Addiction and Mental Health in Toronto, Canada, and also a research consultant with the World Health Organization Europe office. After those presentations, we'll be joined by some other panel members, and we're going to discuss the findings and what they mean in terms of what we can do as a society in terms of tackling alcohol-related harm in young people. So before we get started, I'd like to invite you all to take part in a poll. And I'd just like to invite my colleagues to share that. Thank you very much. So I suppose we're interested in people's perspectives on what they think the top 3 influences are on young people's use of alcohol. And we'll be exploring some of these topics in a little bit more depth throughout the webinar. So just give you a chance to have a think about that. And we'd be delighted if you'd like to share your questions in the Q&A function at the bottom. Please feel free, and any questions that you'd like to direct to our speakers or have discussed in the panel discussion, we'd be delighted to hear from you there. Okay. Thank you very much. And we'll be sharing the results of that poll a little bit later and discussing the findings. So without further ado, I'd like now to introduce you to our first speaker, and that's Dr. Eoin McNamara, research analyst for the Growing Up in Ireland study at the ESRI, and he's going to share some of the research around alcohol in young people from the Growing Up in Ireland study. You're very welcome, Eoin.
Thank you very much, Aisling. I'm just going to share my screen now. Just let me know if you can see that, please.
Yes, Eoin, we can. Thank you.
That's great. Thank you very much. So as Aisling said, I am a researcher with the Growing Up in Ireland study. Growing Up in Ireland is the national study of children and young people in Ireland. We look at all aspects around the development and health of young people. And just today, I'm going to give an overview of some of the trends in alcohol consumption from early adolescence to from adolescence through to early adulthood that we've made from Growing Up in Ireland. So just by way of a background, I'll give you an introduction to the study. So as I said, it's a national longitudinal study of children and young people. It's funded by the Department of Children, and it's overseen by the Department of Children in conjunction with the CSO. The study has been running for 15 years now. So it began in 2007. We have 2 cohorts in the study. So that's 2 groups of young people. They were recruited at ages 9 months and 9 years. And between the 2 groups, we've got around 20,000 young people were recruited into the study. Now, it's a fixed panel study design. So that means that we visit the same children and their families every couple of years. And we conduct face-to-face interviews with them when we do make these visits every few years. We look at all aspects of the children's development. So that includes things like their mental well-being, their educational performance, educational outcomes, their relationships with their peers and their parents. We look at family background characteristics as well. And we also look at physical health. And so one aspect within the realm of physical health is obviously their habits around drinking and alcohol consumption. The overall aims of the study the overall aim is to improve our understanding of the experiences and development of children and young people with a view to informing policies and services. And when you look at the specific objectives of the study, those are to kind of look at what's typical and normal amongst young people and also what's atypical and problematic as well. We want to look at key factors that help and hinder development. We want to look at the effect of early child experiences on later life, and we want to look for the children's own views and opinions on their lives. And when you think about these kind of objectives in the context of drinking behaviors, all of these can be explored. So you can kind of think about what are normal drinking patterns for young people and what's atypical or problematic. What are the key factors in terms of how does drinking affect other aspects of development, and what is the impact of drinking early in life on later life as well? So this graph here gives an overview of all the different waves of the study. As I said, we began in 2007. Just get my laser pointer there. So You can see that there we began around 2007 with the older cohort here at age 9, and we revisit them every couple of years all the way up to now they're around 22, 23 years of age. With the younger cohort, that began when they were 9 months old, and they are now have just been visited at age 13. So in terms of the kind of sort of information we can collect around alcohol behavior, from the parents' perspective, we interview the parents as well, so we can ask about their drinking habits. Like all the way from in utero, so before the children were born, as to what sort of drinking habits the parents had, their general consumption now, and we also ask them to complete this audit scale, so it's an indicator of kind of risky drinking behavior as well. With the young people, obviously when they're younger, we don't ask them about their drinking behavior, but from ages 13 on and all the way up through adolescence and into early adulthood, we can ask them about their age of onset, their general consumption habits, and again, we can get them to complete that audit scale. So just starting with the age 13 interview and some of the findings from that, you can kind of see here, this first graph shows us percentage of 13-year-olds who said they'd ever had an alcoholic drink by the age of 13. So overall, 16% of young people said they had had a drink. Moving beyond that, you can kind of see that there is something of a gender difference. When we break it down, we can kind of see that boys are more inclined to have had a drink at that age than girls. And this is a trend that we'll see that is kind of pervasive throughout adolescence. As you move from 13 to 17 to 20 years, you always tend to see this gender difference. We also see a difference here at this age according to social class. And you can kind of see that children from when you look at the kind of parental education, those from kind of families where the parents have a lower level of education are more inclined to have had a drink. And those from families that would be kind of classed as being kind of slightly lower class, so if the parents are unemployed versus the parents who are professionals or managers, it's those who are kind of what you could kind of consider to be less advantaged are more likely to have had a drink at age 13. So moving on to the next wave of data, this is kind of 3 or 4 years later when they're 17 or 18. At this stage, 89% of all young people had had a drink of alcohol by this stage. And looking kind of specifically at their general habits at this stage, 48% said they drank monthly or less, 40% said they drank 2 to 4 times per month, and 6% said they drank twice weekly or more often than that. Again, we see a gender difference here. So boys or males were more likely to drink often, and when they did drink, they drank more. So 46% of males said that when they were drinking, they drank 7+ units of alcohol versus 29% of females. So quite a stark difference there. And we don't actually see any differences with these findings with regard to social class indicators. So looking at differences between children according to, let's say, parental education or family income. But what we do see is something of a longitudinal trend at this stage. So this is kind of what you can kind of look back to the findings at 13 and see how they are affecting the outcomes at 17, 18. So drinkers at age 13 were more likely to drink often and to drink more at ages 17 and 18. And that's kind of reflected in this graph here. So what we can see is this is the kind of number of units that people consume when they drink. So the two boxes here in pink reflect kind of 7+ units of alcohol when they are drinking. For those young people who said they didn't drink at age 13, 34% of them are consuming 7+ units of alcohol when they drink at age 17, 18. But if they said that they drank at age 13, then it's actually 55% are saying that they're consuming that kind of the larger numbers of alcohol when they are drinking. So a fairly substantial difference there. Moving on, as I said, we have this audit scale. So this is this kind of internationally recognized scale whereby you can kind of rate people's drinking behavior all the way from kind of low risk through to very high risk. Looking at when the 17 and 18-year-olds completed this questionnaire, 46% overall were rated as low risk, 31% rated as kind of having risky or hazardous drinking behavior, and a further 5% were high risk or very high risk. When we look at this group in a little bit more detail, so it's 5% overall are in these kind of the two highest categories. But again, you can kind of see something of a longitudinal trend here. So that figure is actually 4% if they said if they hadn't had a drink at age 13. But if they had had a drink at age 13, then 10% were in this high risk or this very high risk category at age 17 or 18. Moving on to the next wave of data collection, which was done at age 20. 96% at this stage said they had ever had an alcoholic drink. So if you remember back, that was 6% at age 13, 89% at age 17, and now almost all children have had a drink at age 20. Looking back, when we asked the children as to when they had their first drink, I think the average age was somewhere around the age of 16 as to when they had their first drink. 25% of young people told us that they had at some stage tried to reduce their consumption of alcohol or to give up. And 25% said they drank at least twice per week. When we look at these figures in a little bit more detail, breaking it down according to some of the background characteristics, so it's 25% overall drank at least twice per week. Again, we see that gender difference. Boys more likely, or males more likely than females to drink that often, 29 versus 21%. And we also see differences according to social class, according to parental education, and according to family income. But what's really noticeable here is the trend is actually in the opposite direction to what we saw earlier on. So those from what you might consider to be more advantaged families, where the parents have higher levels of education, where the family have higher levels of income, are actually more likely to drink more often. So the most advantaged 20-year-olds were more likely to drink regularly than the less advantaged. We also got the 20-year-olds to complete the audit questionnaire as well. And you can see at this stage, 46% were in this risky category. That was compared to 31%, I think, at ages 31. And 11% are in the two highest categories of high risk or very high risk in terms of their drinking behavior. And if you remember back, that was 5% overall at age 17. So a slight increase there as well. Now, when we break this down, it's similar to what I did in the last graph there. You can see those same trends. Males more likely than females to be in the high risk or very high risk category, as well as those from the what you might consider to be the more advantaged families. So most advantaged, more likely to be in the high risk groups again. Now we can kind of also look at some of the longitudinal trends. So you were much more likely to be in one of these high risk or the very high risk groups if you had either had a drink at age 13. So for those young people, overall, it's 11% are in this high risk or very high risk category, but it increases to 17% if you said that you had a drink at age 13. And it increases massively up to 41% if they were in the risky, so the high risk or the very high risk category at age 17, then 41% of those people were in the same categories at ages 20. So you can kind of see the longitudinal trends there. So just to kind of summarize, that's a very brief overview of some of the findings from the Growing Up in Ireland study with regards to drinking behavior of young people. Obviously, there's loads of I think this kind of probably poses more questions than answers it produces. So some of the other things you could look at with the Growing Up in Ireland data are associations between parent and child drinking behavior. So we have that data on parental drinking behavior all the way from before the children were born through adolescence as well. So you could look at the associations between the two and see if there are kind of links between parents drinking and child drinking. You could also look at the association between drinking behavior, either historical, let's say all the way back to when they were 13, or contemporary at now at 20, 22 years of age, and other developmental outcomes. So what sort of impact does your drinking behavior have on physical health, on your socio-emotional well-being, on your educational attainments, or even career progress beyond that as well? If there are any researchers in the audience who are interested in exploring any of these issues, the GUI datasets are made available for other researchers. So there's two different types of files. They're kind of held by the ISSDA and the CSO. And if you're kind of interested in finding out how you can access those, you can visit the Growing Up website there, growingup.ie, or you can kind of contact me. So just all that's left for me to do now at this stage is to give some thanks to my GUI colleagues. I'm just one member of a very large team. To our colleagues beyond that at the Department of Children, at the CSO, and at Trinity College. And of course, I would like to give thanks to the young people and their families for their continued participation and commitment to the study, and for providing us with all this kind of wonderful data. Thank you very much.
Thank you so much, Eoin. Really, really interesting to see those trends over time, and just shows what a valuable resource the Growing Up in Ireland dataset is. We're going to just let each of the three speakers speak first, and then we'll do a Q&A and pick up on some of the questions that you have for our speakers. So thank you, Eoin. We'll be back to you shortly. It's now my great pleasure to introduce you to Doyle. who's a research officer with the Health Research Board. And Anne is going to speak about some of the risk and protective factors that influence young people's alcohol use. Thank you very much, Anne.
Thank you very much, Aisling. Let me just share my screen. Looking good?
That's perfect, Anne. Thank you.
Great. Thanks for that, Aisling, and thank you for the opportunity to speak here today about this report. And I suppose just before I start, to declare that I've no conflict of interest. What I'm going to talk to you about today is a little bit about the Health Research Board, about this report that includes risk and protective factors, background about youth drinking in Ireland, and then I'll move on to the risk and protective factors, as well as some potential responses. So the HRB, the Health Research Board, we're a state agency under the Department of Health. We publish these overviews on the alcohol situation in Ireland. So they cover how much we're drinking, how we drink, the consequences of our alcohol use. They track trends over time and make international comparisons. And the data included in these reports informs the Department of Health so that when they're making decisions, they're making them on evidence. So the most recent alcohol overview was slightly different to the previous ones in that it specifically focuses on children and young people. And it also differs in that it looks at drug use as well. So we have a chapter on alcohol use, but we also have a chapter then on drug use, such as cocaine, ecstasy, cannabis, new psychoactive substances, nitrous oxide. There's a little bit about polydrug use. So this would be the use of one or two or more substances at the same time or in the same period of time. We have the risk and protective factors that I'll talk further about this morning, the consequences such as hospitalizations, crime, violence, including sexual violence, and harms associated with alcohol, either from their own drinking or somebody else's drinking. The responses include the treatment, the numbers of young people who have attended treatment for their alcohol or drug use, as well as the numbers who have been admitted to psychiatric facilities because of their alcohol use. And there's a chapter 2 about the policy and the legislation governing alcohol and other drug use. So very briefly, and Eoin has already touched on this, but youth drinking in Ireland is a good news story in that there's a delay now in the age of initiation of alcohol use. Back in using the National Drug and Alcohol Survey back in about 20 years ago, the average 15, 16-year-old had started to drink. It's been pushed back a little now in that it's nearer to 17 years for most of the respondents in the National Drug and Alcohol Survey. We've also seen a decline in youth drinking. This is from the HBSE survey, where you can see that there's been a significant decline specifically or particularly among younger adolescents. You can see the decline there is very evident. Less so among older adolescents, but it is still statistically significant, the decline that we see there. And similarly so with reports of being drunk in the lifetime. Again, there's been a decline, and again, more obvious among younger adolescents, but still a positive finding. However, using another survey, the SPAD survey, we are still ranked quite high for our levels of reports of being drunk. We're actually ranked 7th out of 35 European countries, and that's just among adolescents aged 15 to 16 years. So that's obviously of concern. And just to recap, that alcohol consumption contributes to all the leading causes of death for young people in the European region. So what are the risk and protective factors associated with the use of alcohol and other drugs? So risk and protective factors are characteristics or circumstances in a child or young person's life that may or may not influence them to use alcohol and other substances. And I've divided them into kind of 4 very rough categories. And the first of which is the personal factors. So we know that the age of initiation is a huge indicator of potential riskier drinking later in life. And although it's been pushed back and children are delaying alcohol initiation, it is still below the legal age of sale. So it is a key area of concern. There's a number of studies in our report that look at sexual orientation, and they found a couple of studies indicated that young people who had concerns or who were worried about their sexual orientation were more likely to report drinking and drinking in hazardous manner compared to those without such concerns. And there's also a number of personal or personality characteristics that are associated with alcohol use, such as those young people who have higher levels of anxiety, sensitivity, neuroticism, low self-esteem, low body esteem, low levels of resilience, and those who display aggressive or acting out type behaviours. The family plays a huge role as well in protecting, but also as a risk factor. So, for example, parental attitudes to alcohol use are a key indicator. So if parents have liberal or tolerant attitudes to alcohol and drunkenness, their adolescent is more likely to use alcohol and get drunk. Children are watching what we're doing. They see a normalization of alcohol. They're more likely to drink alcohol if we do. Those who experience conflict or violence in the home, more likely to use alcohol. And perhaps a contentious one is the parental provision of alcohol. We know from a number of surveys that children commonly report getting alcohol from their parents. And although this is a practice that many parents believe, and I would have myself in the past thought that this was, a good environment to introduce your child to alcohol at home in a controlled setting. You can monitor what they're drinking, but in fact, all of the Irish evidence, as well as all of the international evidence, indicates that it is a practice that should be avoided. Adolescents who get alcohol from their parents are more likely to seek alcohol elsewhere. They're more likely to report drunkenness. And in fact, it's associated with alcohol dependency later in life, so a higher risk there. Families play a really important role too, in that where adolescents report receiving or having a very positive open communication, warm, loving relationship with their parents, they're less likely to use substances. And parental monitoring, and this is where parents are, they know where their child is at weekends and evenings, they're familiar with their friends and their social group. So the more you're involved in your child's life, the more you can protect them from substance use. A number of social factors, and Eoin touched on this, and it's very interesting that children or young adults who come from higher income families are more likely to drink more regularly and more risky than those from lower income families. And peer substance use, I think we all know that if your friends drink, you're more likely to drink yourself. School also plays a big role in influencing young people on alcohol and other drug use. So where we see children who are having a negative experience at school, they're not getting on with their teachers, their grades are slipping, they're skipping school, and particularly early school leavers are key risk factors. And you can just see a graph there just showing the correlation between grades and alcohol use. So the lower the grade, the higher the alcohol use. A couple of social factors, and the sports and physical activity is a real minefield, especially for parents, because in fact, the research shows that children who participate in sports and physical activity are more likely to consume alcohol, because drinking is kind of a huge part of the culture, particularly in the GAA is one study that I've mentioned, but it is a protective factor for drug use. So it's a minefield for parents where their child is participating in sports, but participation in the arts is a protective factor. Looking at attitudes, risks, availability, and advertising, I've just pulled out a couple of studies that are included in the report. So, for example, almost half of young people do not perceive a great risk in binge drinking. Other adolescents in another study reported that alcohol use is widely used, it's acceptable, and it's associated with having fun. And a quite substantial proportion of just 15-year-old school children in the HBSE study reported that it would be very easy to get alcohol where they live or go to school. And one of the key risk factors for alcohol use among our children is exposure to alcohol marketing. It is absolutely, our children are saturated with alcohol marketing from a very young age. And I've just picked out a number of studies. There's several more in the report. But for example, if you look at the second one there, 98% of TikTok videos with the hashtag alcohol portrayed alcohol in a positive light. There was no negativity shown. And if you think about it, you know, TikTok it's really very young adolescents, even children, who are the majority of users. Another survey there showed that every 15 to 16 seconds in a Six Nations championship, there was an alcohol reference. It's saturated, and it is a huge risk factor. And it encourages drinking, and it encourages risky drinking. So there are policy and legislation responses. There are a number of alcohol prevention programs. I have summarized them in the reports if anyone has any interest in those. I've done my best to collate as much information as possible. The Public Health Alcohol Act, this was enacted in 2018. It, at its heart, is children and young people delaying, preventing substance use, but also to respond to those who need help, as well as the strategy. And there's a number of acts then as well that govern drink driving and sales and drinking in public places. So I've summarized those in the report as well. So just to conclude, to reiterate that not all young people who experience these risk factors consume alcohol or end up engaging in risky drinking, and vice versa. Those who come from very warm homes with no risk factors, they can end up drinking too. This is just a collation of literature that indicates some of the key risk factors. Programs need to be tailored to those at increased risk. And a thank you, I suppose, to anyone who participates or carries out alcohol-related research. It is hugely important to contribute to this body of evidence, and it is used to inform decision-making, policy and service delivery. It's very, very important that we have this information to monitor the impact of the Public Health Alcohol Act, as well as the strategy. So thank you very much, and any questions, or that's my contact details.
Thank you so much, Anne. That was a really comprehensive overview in a short space of time. And I'm sure people, if are interested, might be interested in reading the full report, and the link has been shared. Thank you so much, Anne.
Thank you.
I'm now delighted to introduce you to Dr. Alexander Tran. And Alexander is a researcher at the Centre for Addiction and Mental Health in Toronto, Canada. And we're really fortunate to have him in Dublin, Ireland at the moment, as part of his work with WHO Europe. And WHO Europe, in collaboration with our Department of Health, launched the European Framework for Action on Alcohol 2022 to 2025 just on Monday. And I know, Alex, you've been in town doing some work around looking at labelling. And just to give a little plug for the survey, and we'll share the link in the chat as well, but we'd love people to participate in an online survey around people's views around health warning labels on alcohol products. And I know, Alex, you might be speaking a little bit about this, but I suppose the focus of Alex's presentation today is around learning from Lithuania. I suppose it's always really, really interesting to look at another country and look at the evidence and what we can learn from there. So without further ado, I'll hand over to you, Alex. Thank you.
Thank you, Ashlyn. I appreciate that intro. And again, just to reiterate, we are currently collecting data on these alcohol warning labels and how the public perception of what should be included on alcohol as a warning label as part of my work consulting with the WHO. So any participation in our research that we can get from this group would be much appreciated. Unfortunately, I can't quite present some of those results yet, as clearly the data are still coming in. We do have some preliminary results, but that will have to be a presentation that I share at another time. So again, just to reiterate my role, I'm a researcher looking at alcohol policy and how that affects harms associated with alcohol. So maybe more of a broad picture, how public health can intervene, how the government can intervene to reduce the harms associated with alcohol. So I also have training as a social psychologist. So I've always had a vested interest in kind of the motivation behind people's forms of behavior, specifically around exercise and other health behaviors, but obviously alcohol consumption as a negative health behavior falls under that umbrella as well. So I sit on two sides of the coin. I look at how public policy can affect harms at kind of a macro perspective, but also I've always had, like I said, an intimate interest in how people's individual level factors might affect their decision making and ultimately adopting hazardous behaviors like excessive alcohol consumption. So today I will be presenting some of my work done at CAMH, comparing some of the effects in Lithuania and how they might expand to other European countries, because they also are part of the EU. They have a culture of excessive drinking as well, so they do have some lessons that can be extrapolated to other European countries as well, and hopefully applicable to some of the circumstances here in Ireland. And so specifically, I'll be presenting two papers that I published recently that look at the impact of taxation and minimal legal drinking age in Lithuania on all-cause mortality in young adults. As the previous presenters have discussed, and as you all know because you're in this webinar, alcohol is a serious public health risk. It has many different effects on the body, not limited to kind of diseases of the organs. It has social consequences. People drive and get in car accidents, and it has just such a wide range of different types of harm. And it really is a toxic, poisonous substance that we as a society should take more seriously and treat it like other illicit drugs in terms of the types of harms that it can cause on public health as a whole. And so, as I said, it poses a significant public health risk, and then specifically in the European region, it has the highest level of consumption worldwide. Sorry. And it's actually projected to continue to rise up into 2030 as rates of abstention from alcohol consumption are rapidly dropping and seem to be on an upward trajectory. And so obviously consumption and excessive consumption continues to be a concern and something that we need to start to address as these rates rise. And so one way in which we can limit some of the access to alcohol is to increase the taxation related to it. Obviously, maybe not a popular opinion amongst certain cultures and certain people. Taxation on alcohol, obviously, alcohol is a commodity that people treat very differently than other commodities. It's deeply embedded in different kind of culture, like socially, right? And so to add taxation and make it less accessible can run into some sort of resistance and friction, but largely reviews and meta-analytic papers have shown that it is an effective way to reduce the impact of alcohol-related harm. But obviously, an important consideration when you broadly increase taxation related to alcohol, it may not affect all areas of the population equally. And so if you are interested in reducing the harm of young adults and adolescents, I will discuss today the impact of what something like taxation, which is more broadly focused, might affect some of these individuals, right? So when you introduce these pricing changes, individuals such as heavy drinkers or people who have more limited income, like adolescents, it may or may not be as impactful as I will discuss in these upcoming slides. As well, of course, there are other policies that you can implement as well. Taxation seems to be very effective generally, according to the effect size I demonstrated earlier. But of course, there are other ways that you can target it, to target alcohol-related harm that might be more specific to different types of populations, such as, minimum unit pricing is another alternative to taxation. You can increase the drinking driving laws, possibly punishments for these types of people who violate these laws, and then you can change minimal legal drinking age, or you can also restrict marketing. And specifically in the context of adolescence, alcohol-related harm is particularly troubling because young adults are especially vulnerable. They're very impressionable. They haven't developed neurally. Their brains are still developing, so they don't have the same kind of prefrontal cortex inhibition, and they ultimately engage in more risky decision making, and so it makes them more prone to hazardous drinking patterns. Not only because their brains are underdeveloped, but as we all know, alcohol is disinhibitory. Right? So when you consume alcohol, you do end up becoming more risk-seeking, and then it becomes this sort of snowball effect and can spiral out of control, right? And of course, they're undergoing a very critical growth period as well. So any kind of damage that they may cause in these early stages can have lasting effects into their later adulthood, right? And we also know, of course, as the presenters before me demonstrated, perceptions of peer use seem to be a very strong indicator of consumption and hazardous drinking patterns. So largely you want to be taking into account how you're affecting the peer perception of alcohol among young adolescents, as that's obviously a very key factor to consider, right? And then, of course, we know alcohol is an addictive substance, and as I said, with a very large impact on the global burden of disease. And so to combat generally alcohol-related harm, the WHO has recommended 3 categories of public policy that are most effective in reducing harm, and that is taxation, as I discussed earlier, reducing availability, such as minimal legal drinking age changes, or reducing sort of the density of outlets of alcohol sales, and then bans on marketing and advertising. And so my research team at CAMH is specifically using Lithuania as an example because it provides an excellent opportunity to look at a natural experiment in which there were long periods of loose alcohol regulation that allowed a lot of availability and access to alcohol. And then in a short period of time, they were able to introduce a number of different alcohol policies that were very strict along the lines of the WHO best buys. And we can take a look at following that period, how the consumption patterns and alcohol-related harm changed. And so what makes Lithuania also an interesting example is, as well, it's a high-income country that's part of the EU, so some of these results may be extrapolated to other countries in the EU as well. And they have a very comprehensive national data reporting system, so they have monthly mortality rates for a number of different conditions. They are a relatively small country, so the data that are provided by these organizations, their Department of Health is very up to date and very accurate. And then, as I said, they implemented a number of different best buys, so we can start to evaluate the impact of each one of these different policies and parse apart which ones might be most effective. And so the first study that I'll discuss today, I looked at the effects of taxation on mortality rates in younger adults, and I tried to tease these apart from more general trends. So I'll try to glaze over some of the more mundane scientific aspects of it, but basically I took the monthly all-cause mortality rates for various age groups in Lithuania, and I employed type of analysis that kind of plots out the general trend and trajectory of mortality rates over time. And then I introduced the effect of policies over and above those general trends to see if policies do have an effect on all-cause mortality rates in these different age groups. And so because this is about adolescents and young adults, I will only focus on sort of the younger age group cohort. So we had data from individuals who were 20 to 29 and 30 to 39. And so what I first did was I kind of analyzed the effect over time, which is the sort of red dotted line here. So the mortality rates, monthly mortality rates are demonstrated by the black line. And then I superimposed or introduced the effect of taxation on top of the general trend, which was demonstrated by the red dash line. And we wanted to take a look at, let me see if I can do a pointer here. Sure. At two different periods. So we were interested in a hefty taxation period introduced in 2009, and another hefty tax that was introduced in 2017, whether or not these taxation had an effect on our predictions of all-cause mortality at those two stages. And so the main result was that in the 20 to 29-year-olds, there was a significant effect of this policy in 2009. So it reduced the number of all-cause mortality deaths by 1 per month. So saved about 12 lives per year moving forward after the taxation policy was introduced. But in the 2017, the taxation policy had no effect here. In contrast, in individuals who were aged 30 to 39, again, I plotted the general trend of mortality as this green dotted line here for those 30 to 39. And then we introduced and superimposed the effect of taxation in 2009 and 2017. And so contrary to the 20 to 29-year-olds, the slightly older adults, there was no effect of the 2009 policy, and the mortality rate is quite high here. You can see 23 people are dying per month within the year 2009. But in 2017, there was a significant decrease of 1 death per month. So about, again, similar to the 20 to 29 years, it saved about 12 lives per year. So what we can glean is it does appear that taxation policies, despite changes, cultural shifts, or whatever other factors that are occurring over time, in these trends of all-cause mortality, introducing strict taxation does appear to reduce all-cause mortality in relatively younger age groups. And in a more recent paper, I also looked at the impact of an increase in the minimal legal drinking age in Lithuania. So they increased it from 18 to 20 years of age. And so for this study, I separated the age groups into 3 different categories of 2-year age group cohorts. And again, it was monthly mortality rates between the years of 2001 and 2018. And I employed a similar kind of statistical analyses to take a look at the effect of this policy on all-cause mortality in specifically the 18 to 19-year-olds. So these individuals would be the ones who are most affected by an increase in legal drinking age. Obviously, individuals who are 20 years old would be able to drink regardless of the change in policy, whereas sort of the 15 to 17-year-olds were unable to drink regardless of being sort of whether the policy was 18 or 20 years old, right? Or the minimal legal drinking age was 18 or 20 years old. So what we did was we used the interrupted time series analysis, and we modeled again sort of the trend and in all-cause mortality rates with the inclusion of this minimal legal drinking age introduced in 2018. And so this is the green line is our model for the 15 to 17-year-olds. And then again, we used the rates for 18 and 19-year-olds, producing a model using the statistical methodology, and again, looked at the effects across these 3 different age cohorts. And largely what we found was there was a significant effect of this policy introduced in 2018. It appeared to reduce all-cause mortality rates in those 18 to 19-year-olds with stronger effects in men. As you can see here, the effect size is larger here. And to sort of control for some of the other trends that were going on in neighboring age groups, we produced like differenced time series. So basically we kind of co-varied for some of these younger age groups. We co-varied for 17-year-olds. We co-varied for 20 to 22-year-olds. And it seemed that the effect was relatively robust. It was largely effective across all of our control series in a number of different models. We see here as well in the 15 to 17-year-olds, the effect was driven mostly actually by policy introduced slightly earlier. So there was a reduction as well that we saw in 15 to 17-year-olds. So the importance of controlling for these other time series is that regardless of whether or not this policy was effective, there may be, again, similar to my previous study, trends that are going on within these age groups that you cannot account for. So we found that indeed there's seemed to be a significant decrease around the same time, 2017, 2018. And so this kind of justified our need to control for the time series in our main analysis of the 18 to 19-year-olds. And looking at them individually, we also tested the effect of the policy while introducing some other variables into the equation, into the model, and it seemed to wash out our effect. So when we do control for gross domestic product and a policy that was introduced slightly before 2018, our effects are eliminated, which I will discuss in a moment, or at the end of it, I suppose. And then just to kind of start to get on here, we also recently wrote up and submitted a third study where we kind of looked at these alcohol taxation policies, and we wanted to see whether or not this affects not just all-cause mortality, but sort of a alcohol-specific condition, so liver cirrhosis deaths, and we wanted to look at how it affects hospitalizations as well. And we used similar methodology, this interrupted time series analysis, and we looked at both hospitalization and mortality rates. And I just kind of want to summarize the main finding that was a little bit surprising to us, was that these policies, these taxation policies introduced in 2008, 2017, 2018, although they did result in decreases in mortality rates in liver cirrhosis, they actually were matched with increases in hospitalization. So an interesting consideration when trying to implement policies such as taxation is to kind of look at the overall change to the healthcare system. And yes, you know, maybe you're avoiding deaths, but then if these deaths are simply, you know, being skirted to hospitalizations instead, we need to kind of reconsider maybe the effectiveness and how effective these policies are in the bigger picture, right? So kind of to jump through the findings of all of my studies, basically what I would glean from this work is that these policy effects do seem to influence all-cause mortality in younger adults. They do reduce all-cause mortality rates if the taxation is sufficiently strong, but kind of in adolescents specifically, although there is a decrease in all-cause mortality following the introduction of a change in minimal legal drinking age, an unfortunate consequence of Lithuania introducing a number of different policies all at the same time, it may or may not be confounded by other policies that were introduced earlier, which was, as you saw in 2017, when we added that policy into the equation, it washed out our effect of minimal legal drinking age. There's a number of, you know, different possibilities for why that could be the case. It could be that all of the effect is actually wrapped up in the 2018 policy, but then when you choose a time point prior to it, it confounds it, or it could be mostly driven by the 2017 effect. So it's hard to statistically control for two time points that are so close in proximity. And then also, you know, as we saw in my final study, that some of these policy effects are important to consider from a holistic perspective, in that taxation may lead to some of these detrimental effects, such as an increase in hospitalizations in these younger age groups following taxation. So some conclusions. I hesitate to kind of just read off of my slides here, but based on my kind of summary of these findings and kind of looking at these studies as a whole, I do think that targeting adolescents and young adults is a much more challenging endeavor. So taxation, these policies may work for the larger population, but when looking at these specific age groups who are more prone to risk taking and are seeking avenues to carve their identity and seeking kind of social acceptance from their peers and such, I think it's more important to kind of influence their perceptions of alcohol consumption via marketing, via possibly availability, because it does seem that taxation, although as I showed, it decreased some of these all-cause mortality rates, the accompanying increase of hospitalizations to me indicates that taxation may not be kind of the most effective means to approach reducing harm in this younger age group. And so, it's important to consider implementing a number of different policies altogether in order to kind of ensure that you are able to reduce harm across a broad spectrum of the population. So that's all I have to share. And thank you for listening. And any questions can be directed here.
Thank you so much, Alex. Really fascinating to see the effects of taxation specifically, and looking at another country and seeing what we can learn from them. I'd now like to invite Anne and Eoin to rejoin us. And please do continue with your questions coming in the Q&A function at the bottom. And before we're joined by some of our other panel members, we might just pick up on a few of the things that have emerged from the research you've presented so far. Shirley O'Shea has asked, just as a parent of teenagers, she's surprised by a lot of attitudes of parents towards providing or buying alcohol for the children in a belief that that's a safer or a better option. And I know Eoin and Anne, you both referenced this in your presentations. I'm wondering if you could maybe say a little bit more about the evidence base around this. Eoin, I don't know if you'd like to start.
Well, I think what I mainly said is that we need to do a little bit more research yourself around the association between parent drinking and child drinking. But certainly one of the things I will say is that we've looked at them individually, if you will, and we see similar trends. So when I was speaking about the kind of social class differences, the fact that those from more advantaged families were more inclined to drink, you see that in both the children and the adults as well. And I know that there is an association between, and I think Anne would probably be better placed to speak to that as well, as to the parents' attitudes. If they're more permissive about it, it will lead to the children being more inclined to drink as well. So if we're seeing it amongst more advantaged parents, that's potentially why we're seeing it amongst more advantaged young people. Sorry.
Yes, thank you, Eoin. Anne, would you like to add anything?
Yeah, I suppose a lot of the research that's in our report is based on the Growing Up in Ireland study, so it's such a fantastic resource. But we can see that from not only the GUI study, but several other studies, including the Planet Youth one, which is an excellent resource, that parents, and I know I said to myself, I had to hold my hands up. I would have thought myself that by giving your child alcohol, it was a good thing to do, that it was, you could monitor, it was better to have them drinking at home than drinking in the park or the street. But from all of the evidence, and literally absolutely conclusive evidence, is that they really shouldn't be given alcohol at home, because they are then going on to seek alcohol elsewhere. And I mentioned in the presentation the risks that are involved. There is a higher incidence of binge drinking and dependency. So I think that it's a very clear message, and I get that parents are put in an awful situation, but as parents, if we can collectively say, let's all not give our children alcohol, it's just should be avoided at all costs.
Thank you, Anne. And I know the second part of the question was just around the information available for parents on how to approach that conversation with young people. So we'll pick that up when we're joined by some of our other speakers. We have another question as well, just around the link between alcohol and mental health and the use of alcohol as a coping strategy in terms of dealing with anxiety and mental health difficulties. I'm wondering if somebody might like to speak to that, Anne. I know you referenced the link there, but whoever would like to come in on that one, that'd be great.
I'll just briefly say that there is quite a bit in our report on mental health, and it's a bit of a chicken and egg situation in that, are you drinking because you want to suppress perhaps the mental health difficulties that you're experiencing, or is your drinking leading to poor mental health? But regardless of which is at cause, it is, again, it should be something to be avoided. Alcohol is a depressant. It makes you feel worse in the long term. There's a lot of associated, there's a study, and I can't just find it in this massive report at the moment, but there is a study in here about the very high incidence of alcohol use among young people who have committed suicide, and in self-harm cases, it's very prevalent. So it's a real area of concern, and it's definitely not, it shouldn't be used to self-medicate. I know it is widely used, but it's very detrimental to your mental health to drink alcohol at all.
Thank you, Anne.
Just to kind of echo what Anne is saying there, certainly within Growing Up in Ireland, one of the things we do look at are coping strategies for kind of if young people are feeling stressed. And we did ask that at age 20, and I think it was somewhere in the region of 10% of all young people said that they have kind of turned to alcohol as a coping strategy. I think with slightly more males than females reporting that as well. So as Anne was saying, it's kind of the association is potentially going both ways there. So if you're feeling stressed or having other mental health issues, that can lead to drinking, but also obviously the drinking can lead to the mental health issues as well.
Thank you, Eoin. And again, something I think we might pick up when we're joined by some of our other speakers just around the mental health impact. Alex, there's a question around minimum unit pricing. And we in Ireland have introduced it since January of this year. And I'm wondering if you know, there's a question in the chat around, is there any evidence to suggest that perhaps young people are now moving towards kind of higher strength alcohol, such as spirits, because things that they may have traditionally been drinking, like beers, cider, have become more expensive? Do we know if there's any evidence on that yet?
So I recently was doing a review for a grant, and I'm not sure the state of things here in the EU, but in North America, the rates of liver cirrhosis in sort of younger adults is actually on the rise. So, it's indicative of people kind of over-consuming alcohol causing damage to their bodies. So it does appear to be the case that people are reaching for some of these, higher strength alcohols and consuming alcohols in hazardous ways. So I do think, above and beyond taxation, minimum unit pricing is probably like a more important policy to implement. And some of our research, we're trying to also kind of control for changes in inflation, just to make sure that when we introduce different policies, we are making it in as many ways as possible unaffordable for people to, reduce the accessibility that people have to alcohol. So, in terms of whether or not minimum unit pricing in Ireland is causing people to reach for the stronger drink, I do know that from at least a North American perspective, where, we have introduced minimum unit pricing and we are kind of increasing the price of alcohol in general, there seems to be an associated increase in liver cirrhosis, which, the correlation there isn't direct causation, but it infers some ideas, some conclusions.
Thank you. And Anne, I know that in the Health Research Board, this is something that I'm sure into the future you'd be looking to see. I don't know if you could share anything in terms of plans to look at the impact of minimum unit pricing.
Yeah, constantly looking for to have any research that looks at minimum unit pricing. And I suppose a lot of my work would look to Scotland because they're a bit further down the road to us. And just very recently, I was reading a few articles about the impact of minimum unit pricing in Scotland, and it really hasn't you know, I know a lot of people had concerns. It had a lot of criticism, especially here when it was brought in first. But two particular studies that I was looking at recently were about fatal road traffic collisions and drink driving offences, and minimum unit pricing had reduced those. There was also concerns about cross-border shopping, so that people in Scotland would start to buy their alcohol in England across the border, and that hasn't really materialised either. And there was another study about homeless people and the service providers' experience of what their cohort, their group that they were working with, how MUP had affected them. And there was some anecdotal evidence of turning to perhaps, as Alex said, maybe the stronger strength beverages in comparison to the cider, and a slight increase in the use of street benzos and that kind of thing as well. So we're just watching Scotland, and we're very keen to have our own research here in Ireland to see the impact. But it's part of a suite of measures, and not MUP on its own isn't going to solve the problem. It's all the aspects of the Public Health Alcohol Act, and it is moving in the right direction. It's really important legislation.
Thank you, Anne. And just maybe just one final question to Anne again, if that's okay. There's a couple of people, I suppose, you mentioned that there's some good news for us in the research, and that the trends are improving in terms of initiation, etc., of alcohol use. And I suppose some queries, has that led to perhaps increased drug use amongst adolescents, or is there any evidence around that people are shifting towards other psychoactive substances instead?
Yeah, and it's an interesting one, because when I was looking at the data first, I was like, it does look as we have, and we've seen an increase in our young people's use of particularly cocaine and ecstasy, so stimulant type substances, but it doesn't correlate with the decrease in alcohol. So although it might be, it's not in researcher terms, it's not a statistically significant kind of increase that drug use is replacing alcohol use. It's certainly one to watch, but the experts say that it's not a direct replacement.
Okay, thank you so much. And thank you so much. I'd like you all to stay with us, and we'll pick up more on the conversations that we've started. But I'd like to invite our other panel members now to join us as well. So I'm delighted to be joined by Dr. Ciara Kelly, who's a registrar in public health, currently working as a manager with PwC. And she has done some analysis and research looking at data from Planet Youth research carried out in the West. We also have Eoin Power, who's the CEO of Spunout. Emmet Major is a community liaison worker for East County Galway and South Roscommon. We have also delighted to be joined by Thomas McDonagh, who works in the Drug and Alcohol Programme with Crosscare Youth Services, and two young people, Mairead Devlin and Jessica Delaney, who are going to share their perspectives from a youth perspective. So really delighted to be joined by all of you, and to have such kind of diverse perspectives to pick up on some of the themes that are emerging. Before we get started, I might ask if we could share the poll results that we did earlier. And I suppose these are some of the things that we've been looking at already. Okay, really interesting. So when we look at what people think are the top influences, we see peers there seems to be coming out the strongest, followed by parents, followed by cultural norms, education scoring quite lowly, which is interesting. And then I suppose some of the more public health measures, such as affordability, availability, marketing and advertising, scoring lower. So would anybody like to kick off in terms of commenting on those findings, just that the fact that peers and parents are coming out strongly? I don't know if in any of our speakers, first of all, would like to comment on how they think that compares with the evidence base in terms of what's been shared so far.
It certainly matches what I was speaking about, but I just I'm concerned about the low alcohol marketing and advertising, because I think that we don't even realize how much we're experiencing, or our children, I'm past it now, but our children are experiencing. They are, as I said in the presentation, absolutely saturated with alcohol marketing in all aspects. And I know it is part of the Public Health Alcohol Act, but more needs to be done, and it is having an impact on our children.
Yeah, great. Thank you, Anne. So we might work our way through each of those different influences as we continue our discussion. Just to start with, I suppose I'd love to hear from Mairead and Jessica and Thomas as well, works in the drug and alcohol program in Crosscare. Just in terms of any reactions that you want to make to some of what you've heard, and how, I suppose, it resonates from your experience, what you think influences young people in terms of alcohol use.
Yeah, hi guys. Yeah, so we were kind of just having conversations when the findings were coming out. We found it very interesting. And the guys were kind of saying like peer influence would have a big part to play in making a decision. But we were kind of having a like debate in regards to
sports.
Yeah.
Whereas, for example, like I think personally with a lot of people that let's say do soccer, GAA, they have their match on a Sunday. And I feel like they're less likely to drink on their Saturday night, as you know, you're gonna have your match on your Sunday morning. So I just didn't think personally that sport would have such a high rate of alcohol usage.
And then another big one we were talking and we were having a discussion about was parents actually, and we were saying about that whole parents thing. We like, I suppose from my work, I would have always thought going back it was a good idea for a parent to be in control of that. But then when we were discussing, we were saying that's a good, like Jessica was saying, that's a good idea. Do you know that was a good idea? However, then I asked her, what if your mom didn't let you drink? Where would you go anyway? Would you still drink? And she said, yeah, I probably would. So either way, she's going to drink, even if the parents are in control of her or not. So it's actually quite interesting. We think it was a positive thing to say, but it's still there's probably the young people that are still going to drink. Parents are in control of it. Are they going to keep going off and going to find it somewhere else? So, yeah, it's sparked a good few debates in here. Thank God the mic was muted because we were back and forth with it. So it did open up a discussion and making us actually think to change our minds a little bit, isn't it?
Okay. And when you say you think peers are the biggest influences, can you say a little bit more about how you think peers influence young people today?
I think that, for example, like there's a lot of events like festivals, Longitude in Ireland, you're going to be peer pressured to drink to an extent because these sort of events, they're normalized for drinking. So many people that go to it are not going to drink. So I just think if your friends are drinking, more than likely you're going to be pressured into drinking. There's never really that one person that doesn't drink if you're going out.
Yeah, it's quite strange. Like when you go out with your friends, you never really have the one friend that doesn't drink.
Yeah.
So there's probably something wrong with that one person that doesn't drink. You know, which is quite interesting the way we look at that one, especially at the teenage age. You look at going, oh, why are they not drinking? What's wrong with them? You know, and they're the one with a problem.
Yeah.
So it's still not it's still not a very acceptable choice to not drink once you're in your peer group.
I just think if you're going, like as people say, like you're going for drinks or you're going to the bar, you're going to a restaurant, if you're known to be going to a bar, you're going to drink. Or let's say, I know, for example, if my friends are going to a bar and I'm not planning on drinking, more than likely I'm not going to go. So I wouldn't want to put myself in that position to be there drinking 7-Up or something when it is normalised to be drinking when you're out.
Yeah.
Yeah, and I found like around kind of cultural norms is very interesting because, you know, like speaking on the topic of festivals, you know, it'd be rare to hear of someone saying, oh, I went to Electric Picnic and I was on the water for the weekend. Yeah. It kind of is very like with festivals, events in Ireland, it is very hand in hand. You know, you're going to music festival, there's drink at it, you know, and it kind of is just, yeah, I think that sways people's decisions a lot more as well. And then we were also the topic of the issue of what goes hand in hand with drink now is, I don't know if it's coming up in statistics, but with cocaine is huge among young people. Yeah, like it's absolutely rampant at the moment.
Yeah,
it's madness.
Thank you so much. Just I suppose it's really interesting to hear you were surprised about that findings and the links with sports and clubs. Ciara, I know you've done some analysis on the Planet Youth data on the West, looking at different factors, and I know that was one of the things that you looked at. Would you like to maybe share some of your findings from that research?
Yeah, absolutely. Hi, everyone. Ciara Kelly is my name. I'm a public health specialist registrar based in Dublin in Ireland. And thanks, Aisling, for the opportunity to be part of this fantastic event today. Great to hear all the different perspectives. So a recent piece of research that we did based on the Plan East 2020 data, which I would have worked on with Emmet as well. We did a kind of a snapshot, or what we call a cross-sectional study, which was based on about 4,470 odd 15 to 16-year-old adolescents based in Galway, Mayo and Roscommon. And the purpose of that study was to look at the prevalence of ever binge drinking among the adolescents who participated in the Plan Eat survey, and to look at risk and protective factors for ever binge drinking among that group. And I suppose, I'm sure colloquially everyone knows the term binge drinking, and there can be some variation in definitions of how we consider that around the world, let alone within a given country. But we defined it as consuming 5 or more drinks in a 2-hour period or less, and that was based on looking at the international research on how other countries have defined binge drinking. And what we found is a lot of consistency, I think, with what Anne has presented and Eoin has talked about as well earlier on, in terms of some of the influences on alcohol use among young people. So I suppose the risk factors, first of all, I should say that the prevalence of ever binge drinking, or the proportion of adolescents that said they'd ever had a binge drinking episode before, was about 34%, so just over 1/3 of that group that we studied. And that was slightly higher among males compared to females in the study. And then in terms of the risk factors, I suppose the factors that had the strongest associations with ever binge drinking was sourcing alcohol from friends, having friends that drink alcohol, sourcing alcohol from an adult in the adolescent's life that wasn't their parent, current cigarette use and current cannabis use. So they were the 5 ones with the strongest associations, but I suppose the 4 others were getting alcohol from parents, kind of reporting bad or very bad mental health, importantly getting participating in team or club sports in a typical week. So coming back to what Anne spoke about earlier, unsurprisingly, we actually found an increased, a positive association with increased engagement with schoolwork and classes, which was unexpected and something that I think we need to dig into a little bit more. And then just, I suppose, to touch on the 4 protective factors that we identified, again, a lot of consistency with what we saw in the presentations earlier, but those were female gender, being of non-white ethnicity, parental supervision. So again, we heard about that earlier in Anne's presentation, and also a more negative parental attitude to adolescents becoming drunk. So highlighting really the influence of parents and peers quite strongly, and a couple of other factors that we definitely need to think more research on, like the sports piece that we spoke about earlier as well.
Thanks a million, Ciara. So it is quite surprising that link that's there, but that's the evidence seems to be consistent across different studies. Emmet, I know you're involved in terms of the work around the Planet Youth surveys, and in terms of then working with schools and young people to look at the findings, and I'm just wondering if you'd like to maybe share some of your reflections on that work, and I suppose how you think we can use some of this evidence to inform our work with young people.
And more their parents, I would say. Yeah. I'm just going to share the screen with you here quickly.
Sure.
You should be able to see this okay. Can you see that?
It's just starting to come up now there. Yeah, we can see it now.
It should be a fairly colourful bar chart, is it?
It is, yes.
Yeah, okay. So what you're looking at here is the County Galway report based on the data, if you like, that Ciara's just been talking about, the 2020 survey with about 4,500 young people, 15 to 16 years old. This is on their return to school after doing the junior cert. So most go into TY, some go into 5th year. But this is just a quick question they get asked about how would their parents feel about them using cannabis, about them getting drunk, about using e-cigarettes, and about smoking. And you can see here, this is what the young people say that the parents would be against or very against it. And you can see the huge difference there for getting drunk, right? So the perception of the young people about the parents being cross if they're doing these things is quite striking here. And this is, if you roll that forward down a bit, right, and this is a cross tabulation then against that, right? So for being drunk in their lifetime, drunk in the last month, and then cannabis use in their lifetime. So my parents are against or wouldn't care about me getting drunk, or my parents are, sorry, a bit against or wouldn't care. And can you see the difference there? Yeah, so if basically it's the young people, if they feel their parents are, of the sort that aren't going to be getting too stressed about them going out and getting drunk, you know, they're obviously going to be, what is that, about 2 or 3 times more likely in the data there to be doing so, for not just for alcohol, but for cannabis use as well. So anyway, just something to bear in mind. I just thought I'd show you that quickly. And that's the cross tabulation there against parental drinking. My father and mother gets drunk weekly. You're more likely then to be, you know, using substances yourself. And then substance use against perceived peer alcohol use. How many of your friends do you think drink alcohol? So most or all of my friends drink alcohol, and yellow is some, a few, or none of my friends. So again, it would show very, you know, very striking, you know, a relationship there between my friends drink, or I think my friends drink, which isn't quite the same thing, against your own drinking, right? So some interesting things to see there. And I was just having a quick look. The current 2022 Planet Youth Survey is underway, right? So I was just having a look at the same question here. So this is actually underway at the moment in our 91 schools and centres in the west of Ireland. And this is the same question here. I don't know if you can see this on the screen, sort of a heat map within the survey software. So it'll give you a pretty good idea. But this is exactly the same thing. And it seems that perception has dropped again. Now it's a little bit early because this has to be tidied up in SPSS, but it's showing, or actually if you add our 29.4% against, totally against it, and then 26% or 25.8 very against it, that's going to add up to what, 55? And that compares to, we just go back up here, we would have had that at, okay, across the region, 62, 61, 62. So it's dropped again. You see that what we can see here, the young people's, you know, perception around parental tolerance it seems to have fallen a little bit further. So it's definitely an issue. And something we do with that here, right, is we talk a bit about this with all of our first year incoming parents. So one of the things we develop out of the project in the early stages of this project is high quality information for parents as their children are coming into secondary school. So in our schools in the region, all the parents get this booklet together with the talk about, you know, what's going on. We talk about this is drunken last month during COVID, which is quite that was during December 2020. So it's quite high. It was 26% in 2018 and 20% during COVID. So it's quite impressive in its way that all these young people were still, you know, able to go out and get drunk in the middle of the restrictions. But and that will have probably crept up a bit again in the current round of data. But we talk a little bit about this as well. So parental supply, and I know it's been talked about by Eoin and by Anne as well, but it's an issue. So these are the children that would say they regularly get alcohol from a parent, right? So 18% regularly get alcohol from a parent, 10% say they regularly get alcohol from a friend's parent. And this doesn't include the children who would say, I rarely. So it actually goes up to over 30% if you include the occasionally, sort of I rarely or occasionally get alcohol from a parent. So okay. It's definitely an issue that parents think perhaps it's, you know, a safer thing to do or the right thing to do. But as part of that talk, what we are saying to them, and these will be a collective first year parents to say, listen, if everybody agrees not to give these children alcohol, you will do a huge amount for the long-term health, a huge amount. Because it's
so Emmet, can I just ask if you had one key tip that you'd like to share in terms of how parents can approach this topic?
Well, that's one thing I would say, Aisling, is that by working together, parents can achieve a huge amount by working together. And it does become difficult by third year, sometimes even second year, kids are coming asking for the cans for the disco. And it's a constant, you know, refrain for a while then. But it's the idea, defer, put it off as long as you can. Parents are more comfortable about that than just say no. Negotiate around it, push it off. If you can make it 17, if you can make it 18, come to some agreement around it. But we know that once the first parent or the first handful of parents break, it becomes that much harder for everybody else to hold the line. So that is one thing we definitely do talk a lot about out here. But we're trying to move that whole parental networking piece right down into our national schools here, so that parents are more used to the idea that collectively they can achieve quite a bit. So
Emmet, just if you wouldn't mind, just stop sharing the screen just so we can see the panel members again. But thank you so much, and really interesting to see the local data, and really powerful to be able to have that to use in your local areas in terms of feeding back with schools, parents, young people, and other stakeholders. I just want to pick back up on the topic of mental health, as I know this came up earlier and there were some queries around it. And I suppose, Eoin, if I could come to you and just if you might have any kind of insights to share around that, and I suppose any supports that might be available for young people in terms of if they are using alcohol as a support or coping mechanism to deal with mental health difficulties.
Yeah, absolutely. I was really interested in the discussion. I think Anne described it well, you know, in terms of chicken and egg. I think there's also a scenario where if you're already low and depressed for other reasons, or maybe low self-esteem, maybe perhaps you're already self-harming, turning to alcohol as a coping mechanism. Lots of young people don't realize that it is a depressant, and so therefore it will make you feel worse ultimately at the end. And I think really what we have to start doing to try to arrest that is helping young people to develop emotional regulation in healthier ways, you know, equipping young people with coping skills for the inevitable feelings that they're going to feel throughout adolescence that we've all gone through. And I think, you know, there's so much evidence out there to show that, for example, alcohol is a factor in obviously suicide, which is a really a lot of complex factors coming together. So I think we have to get ahead of that. You know, I think Mairead was talking earlier about cultural norms, and you know, young people, when we talk to them about alcohol, one of the most frustrating things is that everything in Ireland socially seems to be revolving around alcohol. And so investing in spaces and places and activities for young people where they can develop and socialize in alcohol kind of free environments is just really important. I think in terms of supports, I think there's two things. Number one, you know, I think we really have to try and help young people to come at this from a really kind of non-judgmental perspective. So things like, if people have seen Hello Sunday Morning, it's an Australian kind of movement, but it seems to be kind of moving, you know, across the world. It's kind of a place and space for young people to start to look at their own alcohol consumption and think about what it's costing. So I think it's not, obviously, you know, we talk about price and affordability and accessibility and things like that, but a lot of it for young people is actually what impact is it having on me as a person? What impact is it having on my mood? And how can I maybe make some changes that are long lasting? And then the other piece then is, you know, we have a 24/7 texting service where we get a lot of young people coming to us, talking to us about kind of the pressure that they feel from their friends, and also kind of the impact that alcohol. I think one of the most telling things is that our service is busiest on Sunday nights and Monday mornings. So after folks, you know, have had their socializing over the course of the weekend, and when maybe people are feeling lower than they were when they, you know, on Friday evening went out and kind of were socializing. So yeah, if there's any young people on the call, or if there are people who are working with young people, that service is available. Text 50808.ie for more information.
Brilliant. Thank you so much, Eoin. And that idea of kind of teaching the kind of the emotional regulation skills. I know that there's work ongoing through our education programme around developing resources for teachers and SPHE around supporting and promoting positive mental health. But just, I suppose, to pick up on that topic of schools, just would anyone like to come in terms of what you think needs to happen in schools and our education system and further in higher education system to support young people around this topic? I don't know if that's something maybe, Emmet, that you want to pick up on, or indeed Mairead and Jessica, if you've thoughts just from your experience around what more you think could be happening.
Guys, if you've anything to say there, I'll happily jump in behind you.
Great.
Thanks, Emmet. Yeah, Tom.
Yeah. Just so what am I now? I'm 6 years out of school, I think. And just more, I think, education around drugs and alcohol. I suppose I actually probably would have got little to none education in school around drug and alcohol education. So yeah, I think that'd be definitely, you know, when I went to college, I done community youth development, so obviously I learned a little bit more there. But yeah, I would have had little to no education. So I think that kind of feeds into the early drinking, early smoking, early kind of everything, because you don't really understand the risk factors with it.
Yeah, I do feel like school brushes over the real impacts that you are emphasizing on, like the way if you have bad mental health, alcohol is actually affecting it more, rather than, I feel like that isn't really emphasized in schools and the effects that aren't truly there. More than we're just told, don't drink. You can, like, we're just told literally don't drink, that's about it. We're not really shown the true effects in the long run.
Okay, so there's definitely more work to do in schools in terms of education. And just to mention some of the resources, so we do have Know the Score, which is the senior cycle programme, and that's available. I think that the link will hopefully be shared in the chat. And also Developing Healthy Choices at the moment, and year 1 of that is available, which is the junior cycle programme. But really helpful to get that insight in terms of what more needs to be done. There is a comment just in the chat around whether the panel has any views on drink aware and alcohol industry input into schools and working with young people.
Can I jump in?
Emmet or Anne, I think you're both hoping to get in on that one.
Anne, fire away, I'll come in.
Oh, I was just going to say that I think education needs to start younger. It's primary school, because it's too late really by the time we get into secondary school, or certainly by the time you get into TY. And that alcohol education should only be delivered by the HSE and not an alcohol industry funded organisation.
Yeah,
absolutely.
I know there's developments about to happen there. I was at a presentation about this last week where they're looking to, with the IMARC people are going to be doing something with that, but there's kind of two circulars have gone out to secondary schools asking them not to engage with the Drink Aware program, and there's all sorts of difficulties and problems associated with that. Just to touch on the Know the Score, I know the Know the Score, I was looking at it this morning, it's a good resource, but it's sort of, as you're saying there, Anne, it's pitched quite late. You know, it's a senior cycle SPHE. And I think, Aisling, we could have a conversation about this separately to this, but I did a sort of something of a straw poll with our schools out in the West back in September, October. We're doing a program with them. And I asked, I think 40 of them if they're doing senior cycle SPHE, and I think 2 of them are. So it might be, you know, pitched at senior cycle SPHE, but they're not doing senior cycle SPHE, broadly speaking. So it might be a good resource, but I don't think it's being delivered in the classroom. And that's enough. We'd have to look at cracking some other way, perhaps. And within the junior cycle SPHE program, if you pull the workbooks and look at what kids are being doing in their time in junior cycle SPHE, they're not really honing in on the drug and alcohol piece either. So our kids can go through a whole way through school and get very little drug or alcohol education in Ireland. It's my experience of working in that space. I think it needs a bit of looking at. But in terms of the prevention,
and certainly I'm just really happy to pick up that conversation with you, and it's something we are looking at the moment, and trying to see how we can improve implementation. But I think that point is well made, just around needing to start earlier and to look at primary school as well. I'm conscious of the time, so I just have one final question, and there's been such rich discussion. I could keep talking with you all for a lot longer. But just, I suppose, one final question, I suppose, to move it more into maybe the policy space and what needs to happen at a policy level. There's a really good question, just what's the one single action that you think our government should take that we can all get behind? So I might come to all of you and ask you what you think that should be. And I might start with Alex, if you're happy to get us kickstarted on that.
Sure. I think to target that specific population, I really do find that restrictions on marketing are so important. Like, you know, I was part of a co-creation workshop just yesterday for some of my consulting work with WHO, and we had recovering addicts come in and discuss some of their experiences, and everything, you know, that kind of propelled them down that path was just the glamorization of alcohol consumption. Like, the bottles look really nice, and, you know, associated with this kind of social success and social status. And, you know, now with the advent of social media, it's so much more difficult to kind of maintain the beast that is marketing, because it becomes peer-to-peer marketing. You know, people are getting videos of themselves in the club, like kind of just consuming copious amounts of alcohol. Like that kind of, you know, widespread kind of perspective on it is like very dangerous. So I think if we can find ways to like police, you know, the way that alcohol is portrayed, or at least like counter advertising marketing, like public service announcements that portray, you know, the detriments, like the, you know, long-term effects of alcohol abuse, like people, who have neuropathy, like talking about having the shakes, like these are very scary consequences that happen to your body after, years of alcohol abuse. It creeps up on you, even not just binge drinking, but, social drinking, 1 or 2 drinks, per day over the week, like that also significantly increases the risks of breast cancer and other colorectal cancers. Like all these things are need to be out there to combat the industry-led view that alcohol is just fun. It's social. It's, you can have 1 or 2 drinks and it's okay. Like these are very dangerous messages to have being propagated amongst the youth. So that's my stance on it.
Thank you, Alex. Ciara, I'll come to you next.
Thanks, Aisling. I would certainly echo what Alex has said there, but I think we can definitely get behind the full implementation of our Public Health Alcohol Act. I know Anna's spoken with that already in her presentation as well, and we have seen a lot of work over the past kind of 2-3 years on getting those provisions in place and fully implemented. But from a policy perspective, to achieve the key objectives that it has set out in terms of reducing alcohol consumption, delaying initiation of alcohol among our children and young people, reducing alcohol harm, enforcing regulations on sale and supply, we have to have full implementation of the Act. And I think kind of key area where we talked maybe a little bit earlier on about was in terms of health information and labeling, and that theme of this week's Awareness Week being the right to know. I think that's a key thing we can all get behind and support the survey that you've spoken about already today as well. It'd be great to get as many views as possible on that, and then also progressing the restrictions that we've already started on the marketing and advertising perspective. I know a broadcast watershed in terms of TV and radio is an area where we still need further implementation. And we touched a little bit on, someone mentioned TikTok earlier, but that's obviously a whole other beast that we will need to think about down the line. But I think if we can get behind the full implementation of our current legislative framework, I think that's a really important place to kick off and start. Thanks.
Thank you, Ciara. Anne?
Ciara's just said everything that I wanted to say. So I think labeling is a huge issue, and we already have this legislation. So it just to commence it as soon as possible would be fantastic. It would make a difference.
Thank you, Anne. Eoin?
Yeah, look, I think endorse everything that's been said, particularly marketing. I mean, I was just looking at the Niall Horan and Lewis Capaldi documentary last night, and Guinness front and center in almost every frame, which was scary. The thing, I guess, for me is that there's lots happening in the legislative and regulatory space, which is great. So maybe starting to look at the cultural norms and kind of creating those alcohol-free spaces for young people to socialize in a way. And secondly, investing in kind of developing young people's alternative coping skills, which should be the primary coping skills that young people have.
Brilliant. Thanks, Eoin. Eoin?
Yeah, I guess just one takeaway from growing up in Ireland would be the fact the age of onset is if they start drinking by age 13, that's going to have an effect on their drinking behaviour at 17 and 18 and at 20 and beyond that as well. So I think the kind of takeaway from that would be the fact that we should be targeting any sort of intervention targeted at young people should be kind of reaching them before that age.
Yes. Yeah. Thank you, Eoin. Emmet?
Well, I'd be a big proponent of the idea of primary prevention, and this idea, can we improve the landscape that children are growing up in so that they're not, it's something around changing these cultural norms and investing more in opportunities for our young people, something akin to what they've been, working on so well up in Iceland. We're trying to emulate some of that with Project Out Here. And hopefully in time we'll get towards that. But it's that idea, can we improve some simple things in the landscape that will have this overall payoff, improve health and well-being, not just around alcohol use, but other things for our young people. Putting aside not being able to have that big investment in extracurricular and opportunities in that line, high quality parenting programs that really should be pushing more and taking the stigma out of parents going for parenting programs and getting more of those available. And I think that would be something that could have a big big effect over time, as well as all parents should really be doing parenting programs, not just the ones who feel they're being forced into it. So that would be one thing. I think a lot of effort could go in there, would make a huge difference, I think.
Thank you, Emmet. And I want to leave the last word to our young people. So Thomas, Mairead and Jessica, do you have one key thing you'd like to see happen?
We were just saying that bringing it into the school curriculum would be really of interest, and also then possibly there's hundreds of thousands of people that have left school as well now, so it's maybe somewhat how you can incorporate into workplace environments and, you know, education around that, because there is lots of people who don't know the full impacts of drinking, including myself probably, yeah.
And I think we were saying is it should be made to young people from a young age to talk about it a lot more, to break down the stigma. We're so good as a nation of a taboo and not talking about certain things because we don't want to cause upset or things. But people see this on a daily. We see it on Christmas and birthdays and parties and funerals and weddings, and there's always alcohol that's around. You know, that we associate that, or we always have. Every one of us, we could all say that. So maybe young people should know about it more, so that they're not afraid to talk about it. They can see the good, the bad, and the really bad effects on it, rather than just thinking it's just a party, you know, or just a good time. So a younger age to break down that stigma is probably the best way to go, because young people want to know, young people want to share, like they're the future of tomorrow. They know what they want, you know, and for them to be involved in it is very important.
I think young people do need to hear the stories though of people that have experienced the impacts, because a lot of people they're not going to listen until they've heard the experiences and the true impacts. Because I know the person, if I'm being told something, I'd rather hear what actually happened to someone else and their experiences, so I can take that in properly.
So those personal stories, personal stories are really important. Listen, thank you so much. We could keep talking for a lot longer, and it's been so fascinating to hear all of your different perspectives. I know we're over time, so thank you to those of you who are still with us. Really appreciate it. And just to conclude, just like to thank all of our speakers, all of our panel members, IMS, our colleagues providing support in the background, my colleagues Katie, Noreen and Fergal are providing background support, and just to thank you all so much for joining us today. We hope you found some of the resources that have been shared useful. Just like to mention the HSE's website, askaboutalcohol.ie, has lots more information and tips for parents, etc., in terms of how to talk about these topics with young people. We will be sharing a post-webinar survey, and we just really appreciate your feedback. But just thank you so much for joining us, and we hope to see you again soon. Thank you.